Hi, folks. Thanks for being here with us today. I am Mauricio Tohen. I'm a distinguished professor and chair of the Department of Psychiatry and Behavioral Sciences at the University of New Mexico, and it's a pleasure for me to be with you today. So today we're going to be talking about hot topics in mental health. Specifically, we're going to focus on bipolar disorder. Bipolar disorder has been in my area of interest clinically, research, and teaching for the last number of years. So hopefully we can add value to your practice. Can you share your thoughts on the evidence supporting the use of long-acting injectables as a way to prevent relapse in patients diagnosed with bipolar disorder? Let's start by addressing the issue of maintenance treatment in patients with bipolar disorder. That is, of course, something that is needed, and it's needed early on. I would say that most likely because it's only going to be less than 10% that have one episode only. So the vast majority of patients are going to need maintenance treatment. My view, folks, colleagues, is that long-acting antipsychotics have been underutilized in bipolar disorder. We tend to think in our country that it's mostly for patients with schizophrenia. In Europe and other parts of the world, they're more broadly used both in schizophrenia and other conditions. But in bipolar disorder, we definitely need to consider the use of long-acting injectables. And there's been a number of studies. Different medications have been approved, medications, antipsychotics, available as long-acting intramuscular have been approved by the FDA for this indication. So should we consider them at first episode? I guess it would be in some cases, but probably it would wait until the patient has had at least 2 episodes. But is it contraindicated in first episode? No. And I'll be happy to give you an example patient who is aware of the availability of injectables and has responded well to an antipsychotic and would like to, because of convenience, go on injectables. Would that be contraindicated? It wouldn't, but I would discuss with the patient the possibility that it's a single episode only. But let's say a patient has a twin brother with bipolar disorder who has similar episodes. And I mention a twin brother because I do happen to have under my care 2 identical twins who suffer from bipolar disorder. Folks, I hope that this presentation was helpful. If you have any questions, please send them to us. And thank you for being here with us today.